Assalamu alaikum. Beta, in this video lecture, I will start delivering the pharmacology of your neurosciences. So let's talk about the very first topic, that is antipsychotic drugs, right? We'll be discussing all the topics: antipsychotics, antidepressants, antiepileptics, and all. So the very first is going to be the antipsychotics in this video lecture. Antipsychotics, we first need to understand, beta, what is psychosis. Before you understand what do antipsychotic drugs do, what is your concept of psychosis? Psychosis, by definition, it is a mental disorder. It's a group of severe mental disorders. It's not a single disorder. Psychosis is a group of severe mental disorders in which there is loss of contact with reality. The contact with the reality is lost. Reality is, for example, reality is there is nobody sitting in front of me. But if I am suffering from psychosis, I will say somebody is sitting in front of me. You understand what is psychosis? Contact with reality is lost. As I told you the example, nobody is sitting in front of me actually, but if I keep on insisting that somebody is sitting in front of me, looking at me, this is what we call in our language the visual hallucination. By the way, psychosis is a group of severe mental disorders in which there is loss of contact with reality. Reality is something different, but you have lost the contact with the reality. Understand? It's a severe. So this is psychosis. To relieve this psychosis, we provide the patient with antipsychotic drugs. And remember, schizophrenia, or whatever you say, schizophrenia, different people have different pronunciations, but here we'll say schizophrenia. Schizophrenia is a neurologic disorder in which people suffer from psychosis. Now you people understand what is psychosis? Loss of contact with reality. And schizophrenia is a very good example of psychosis. Okay? And to relieve psychosis, we provide the patient with antipsychotics. Antipsychotic drugs, they are used primarily to treat the schizophrenia, which is a chronic psychotic disorder. Antipsychotic drugs, they do not eliminate the chronic thought disorder, but they decrease the intensity of hallucinations and the delusions. I mean to say, antipsychotic drugs do not cure the disease. They are just symptomatic relief. They provide the symptomatic relief. You have delusions, hallucinations, all are the part of psychosis. So antipsychotic drugs just relieve your symptoms of psychosis which you see in schizophrenia, like hallucinations, delusions and all. But the actual pathology cannot be treated. Okay? What is schizophrenia? It is a chronic psychosis, very good example of psychosis, especially the chronic psychosis, characterized by delusions, hallucinations, and disturbances in the thought. You understand? What are the delusions? Delusions, a fast, very, very authentic belief. Delusions is very firm belief, but there is loss of contact with the reality. And belief on something which is not actually there, or which is not actually real. Okay? And hallucinations, they can be auditory hallucinations, visual hallucinations, right? Perception without stimulus. That is what we call hallucination. Now can you relate all these things with this psychosis? Loss of contact with the reality. You are believing, you are actually believing on something which is not there. False belief. So you have lost the contact with the reality. You are hearing something which is not even there. So you have lost the contact with reality. Number 3, disturbances in the thought. Okay. And the very sad thing about this disease, schizophrenia, is the onset of this disease is in the late adolescence or the early adulthood. The days of enjoyment, the days where you love to have beautiful thoughts in your mind, where you love to hear some beautiful voices. But unfortunately, schizophrenia develops in the late adolescence or early adulthood, which is very early age. Yeah. Now, the question is, why schizophrenia? Now you see how I started it. Firstly I told you what is psychosis. Then I told you to relieve psychosis, we can provide the patient with antipsychotics. Antipsychotics just simply relieve the symptoms, but cannot treat the underlying pathology. Then I told you a very good example of psychosis, chronic psychosis, is schizophrenia, a neurologic disorder, in which everything, delusions are there, hallucinations, thought disturbances, all in psychosis. Okay, you now understand? Okay, why schizophrenia? Where exactly is the pathology? Schizophrenia is possibly a dysfunction of the mesolimbic or mesocortical dopaminergic neuronal pathways. ये मैं सर्किट आपको दिखाता हूँ, समझाता हूँ. 2 पाथवेज होते हैं बेटा, एक मीजोलिम्बिक पाथवे होता है, एक मीजोकॉर्टिकल डोपामिनर्जिक न्यूरोनल पाथवे होता है. Actually what happens, let me share with you. You can even see in this picture in just a second. Yeah, there we go. Can you see beta? This beautiful is kind of picture. The CNS starting from here. This is the brain stem. Here at the back is the cerebellum, the pons medulla, and this part is the midbrain, right? This part is the midbrain. If you want me to highlight it, that I'm referring to this part. This part is midbrain. Okay. And can you see in the midbrain, this structure is present, this red colored body, and from this red colored body some fibers are arising and they are going up towards this structure in the cerebrum, right? What is this structure present in the midbrain? Substantia nigra. What is this structure called? Substantia nigra, present in the midbrain, and the fibers, they are arising from the substantia nigra in the midbrain. And where are they heading towards? They are heading towards the limbic system, right? Limbic system. इसके obviously multiple parts होते हैं. We are not going to discuss about the anatomy here, but the fibers are arising from the substantia nigra in the midbrain and heading towards the limbic system. So this is said to be, this pathway, this circuit is called mesolimbic pathway. Why meso? Because the fibers are arising from the substantia nigra in the mesencephalon, that is the midbrain. So we say meso, and they are terminating in the limbic system, so mesolimbic pathway. And this is the dopaminergic pathway, because the neurons which are arising from the substantia nigra and terminating at the limbic system, they are releasing what neurotransmitter with the red color? You can see these red neurotransmitters, the dopamine. Okay, isn't it very much easy? So actually, in case of schizophrenia, which is a chronic psychotic disorder, in schizophrenia there is problem in this pathway, right? There is problem in this pathway. What problem? We'll surely talk about that, but for now you just understand there is some kind of problem in this mesolimbic pathway, right? Okay, you see here beta, normally I told you this pathway is there. Now can you see these two neurons? This is the neuron of your mesolimbic pathway, and this is the neuron of your limbic system. With the green is the with the green is this limbic system. With this red is the mesolimbic pathway. You can see one neuron from here, one neuron from here, This is the presynaptic, this is the postsynaptic neuron. Can you see this from this presynaptic neuron? This is the neuron of the mesolimbic pathway. Dopamine is being released, and dopamine is binding with its D1 receptor on the postsynaptic neuron in the limbic system. And when the dopamine passes here to this limbic system, some activity is produced, especially the thought process and everything related to your cognitive behavior, your personality, right? So if you want to keep it easy, you just keep it in your mind. Simply, the fibers are arising from the substantia nigra in the midbrain. They are ending towards the limbic system. This circuit is said to be the mesolimbic pathway, releasing the dopamine in the synaptic cleft, and then this dopamine goes all the ways to the postsynaptic neuron in the limbic system. And this is what happens normally. This dopamine transmission occurs. But what happens in schizophrenia? What is the problem in the schizophrenia? Increased dopaminergic transmission. Increased dopaminergic transmission. Simple. Don't really confuse it. The dopaminergic transmission from this pathway to the limbic system is increased very much. Lots of dopamine being released and lots of dopaminergic stimulation of this limbic system. When this limbic system is normally it is tonically stimulated, but when there is the rush of dopamine from the mesolimbic pathway to the limbic system, then actually the problem comes up. That is what we call schizophrenia. You understand now? Okay. Right, beta. So now, yeah, okay. If I take you here, before I talk about the drugs, I have to make you clear with one more thing. Here, just a recap first, and then I'll take you a little away. You can see, beta, again, this is the same picture. This is the brain stem. Here must be your cerebellum, okay, posteriorly, and this is the midbrain, okay. And in the midbrain you can see this substantia nigra is present. From this substantia nigra, the fibers are arising towards the limbic system, and that is what we call the mesolimbic pathway. And can you see there is another circuit arising from the substantia nigra, but it is not heading towards the limbic system, but heading towards the prefrontal cortex of the cerebrum, the frontal prefrontal cortex, which is mainly concerned with the behavior and personality. Understand? Mainly concerned with the behavior and personality. So the two circuits are arising, one going towards the limbic system, that is what we call the mesolimbic pathway, and this is the mesocortical pathway, rising from the mesencephalon to the cortex, what we call the mesocortical pathway. In case of schizophrenia, there is problem not only in the mesolimbic pathway, there is problem also in the mesocortical pathway. What was the problem in the mesolimbic circuit? There was the increased dopaminergic transmission. Right? And what about this mesocortical pathway? There is also problem in the schizophrenia. But what problem? Decreased dopaminergic transmission, neurotransmission. Right? Now you can see here. Look, what happens in schizophrenia? Imbalance in the dopaminergic activity between the mesolimbic and the mesocortical pathway. So when there is the imbalance in the dopaminergic activity between the mesolimbic and the mesocortical pathway, you develop schizophrenia, right? The dopaminergic activity in the mesolimbic pathway is increased, and here it is decreased. You can see here that the imbalance is created. What imbalance? The dopaminergic activity in the mesolimbic pathway is increased, and the dopaminergic activity in the mesocortical pathway is decreased. And because in the mesolimbic pathway the dopaminergic activity is increased, some symptoms are produced. Some symptoms of schizophrenia are produced, and due to decreased dopaminergic transmission in the mesocortical pathway, some other symptoms are produced. The symptoms which are produced due to increased dopaminergic neurotransmission in the mesolimbic pathway, they are said to be the positive symptoms. I'll say, why do we call it positive symptoms? And the decreased dopaminergic neurotransmission in the mesocortical pathway lead to, some other symptoms that are what we call the negative symptoms. Now, firstly, I'll tell you why do we call it the positive symptoms and negative symptoms, and then we go ahead. Positive symptoms, the symptoms which are added to your daily life, to your personality, like delusions, hallucinations. What do you think? Normal people, you and I have delusions and hallucinations normally? Do you and I have hallucinations and delusions normally? No. But the patient with the schizophrenia, they do have these problems. So that means there is something added to their life due to the problem. You understand? But due to the decreased dopaminergic neurotransmission in the mesocortical pathway, negative symptoms are produced. The symptoms which are produced are something which is actually taken away from the life of the normal individual. What do you think normal individual should behave like? He must be wearing some very good clothes, sitting with some good manners in the classroom, right? And he should be, socially active, doing some exercise, having some happy life, right? What we people do, waking up early in the morning, yeah, having some, some good time out in the park, some yoga and everything down there. There's a very good social, you see what I'm trying to insist on. The normal individual, what he does, gets up early in the morning, go to the park out, have some good time out there, go to your college, have some good time there with the friends. But the patient with the schizophrenia, this part from their life is subtracted. Patient with schizophrenia, he doesn't like to go out, waking up early in the morning, going out in the park, having some chill with their friends, right at 7 o'clock, going to the college, having some nice party there with the friends. Social withdrawal is there. He loves to sit inside his room all the times. So something is actually taken out of his life. नॉर्मल इंडिविजुअल में से आप कोई चीज़ निकाल रहे हैं. नॉर्मल इंडिविजुअल कैसा होना चाहिए? सोशली एक्टिव होना चाहिए, हैप्पी होना चाहिए, कूल होना चाहिए. सोशल विड्रॉल अगर हो जाए, उसकी पर्सनालिटी में, बिहेवियर में चेंजेस आ जाएं, तो वो नेगेटिव सिम्टम्स कहलाते हैं. क्यों? क्योंकि वो उसकी इंडिविजुअलिटी में से, उसकी लाइफ में से सब्सट्रैक्ट हो गए, विच शुड बी देयर इन एवरीबडी. यू नाउ अंडरस्टैंड? Positive symptoms are symptoms that are actually given to the patient. The patient was very much normal earlier. He developed schizophrenia and he got symptoms like delusions and the hallucinations. The symptoms he received additionally. Negative symptoms are the symptoms actually which are due to the, you are taking something away from the patient's life, normal individual's life. The normal, like I and you, should be very much, socially active, doing our, daily activities with a particular time schedule. You understand what I'm trying to say? But the patient with the schizophrenia is not doing the same what we are doing. He loves to sit inside his room 24/7. Social withdrawal, personality, behavior changes. You understand better now the difference between the positive and the negative symptoms? I hope it is not difficult now. So yeah, the positive symptoms are produced due to problem in the mesolimbic pathway, due to increased dopaminergic transmission, and the negative symptoms are produced due to decreased dopaminergic neurotransmission in the mesocortical pathway. And here, to produce the negative symptoms, there is obviously the role of the dopamine, but alongside there is also some role of the glutamate and the serotonin receptors as well. The pathology is not well defined, but yeah, there is. Okay, so I hope it is now clear to you.